Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, the June 29th, 2017 Longevity Magazine Journal had an article that caught my eye regarding the medicinal value of apple cider vinegar. Now, over the years, many patients have asked me about the health benefits of apple cider vinegar, but in truth, I knew very little about it, and I really hadn't seen a lot of published clinical trials on humans to support any proven therapeutic effects. However, in recent years, several well-designed studies have shown a positive effect on diabetes management regarding the ability of vinegar products to reduce blood sugar and possibly even improve insulin sensitivity. So to understand it better, white distilled vinegars are generally 4 to 7% acetic acid, whereas cider and wine vinegars are 5 to 6% acetic acid. And studies suggest that it's the acetic acid in vinegar that has the blood sugar lowering effect. Now, experimental studies show that acetic acid slows down the absorption of carbohydrates from the gut into the bloodstream by inhibiting certain carbohydrate digesting enzymes in the intestinal tract. How acetic acid may improve insulin sensitivity, which lowers the body's demand for insulin, is still a bit of a mystery. But if that's the case, if it can really do that, it's a marvelous thing for diabetics and pre-diabetics, as lowering circulating insulin helps to reduce the conversion of carbohydrates into fat. And there's some preliminary evidence that apple cider vinegar may also aid in weight loss, we think via reduction of body fat. Now, with respect to lowering the post-meal blood sugar, one study in non-diabetic subjects demonstrated that 20 milliliters of white vinegar at 5% acetic acid as a salad dressing ingredient reduced blood sugar rise by 30% following a mixed meal. So the mixed meal consisted of a lettuce salad that had vinegar as part of the dressing, and white bread, which contained 50 grams of carbohydrate. So it lowered the blood sugar rise in that meal by 30% compared to the meal that didn't have the vinegar. Now, while compiling a glycemic index table for 32 common Japanese foods, other researchers discovered that the addition of vinegar or pickled foods to rice, let's say you're having sushi, that it decreased the blood sugar elevation of rice consumption by 20 to 35%. So it made the consumption of rice have a much lower effect on raising blood sugar if it was consumed sort of with vinegar containing or pickled foods that had vinegar associated with it. Now, a researcher named Osman and colleagues reported that substitution of a pickled cucumber that had 1.6 grams of acetic acid for a fresh cucumber which has no acetic acid in a test meal, and the test meal was bread, butter, and yogurt, it reduced the post-meal blood sugar rise by over 30% in healthy subjects. Now, more recently, there was a crossover trial with individuals with insulin resistance and individuals with type 2 diabetes. They consumed a vinegar test drink or a placebo immediately before consuming a mixed meal containing 87 grams of total carbohydrates. Now, in the insulin resistant subjects, the vinegar ingestion reduced the post-meal blood sugar rise by 64% compared to subjects ingesting the placebo, and it improved the post-meal insulin sensitivity by 34%. So the vinegar drink that they consumed before the meal consisted of 20 grams of vinegar dissolved in 40 grams of water and 1 teaspoon of saccharin. Now, a 64% reduction in blood sugar compared to the placebo is quite an amazing finding, actually. Now, in the individuals with type 2 diabetes, the same vinegar drink produced a 17% reduction in post-meal blood sugar and a 19% improvement in post-meal insulin sensitivity, still very impressive values. Now, other studies on healthy subjects by Osman and fellow researchers also showed a reduction in post-meal blood sugar and improved insulin sensitivity. So even in healthy people, there seems to be a benefit in helping to really regulate blood sugar and keep insulin sensitivity at a higher point. And those ingesting the vinegar with meals also reported greater meal satiety. They felt more full. So the suggestion is that the ingestion of vinegar at meals may help people lose weight by making them feel more content and less inclined to overeat. Now, with respect to other health conditions, because I get asked about this all the time, right now there's insufficient evidence from the published human studies to declare that apple cider vinegar or other forms of vinegar can reduce blood pressure or prevent cancer or reduce cholesterol or improve arthritic conditions. The jury is still out on those health matters. However, if your blood sugar is a bit too high, or you're already in the diabetic range of blood sugar, it really may be prudent to consume more vinegar and vinegar-containing products with your meals. Let's say, oil and vinegar salad dressings, or include more pickled foods containing vinegar. But be careful that the sodium content of whatever is pickled is not too high that it's going to raise your blood pressure. You may even want to consider ingesting 2 teaspoons or more of apple cider vinegar mixed into a cup of water or juice at 1 or 2 meals per day, just to get that extra vinegar kick. Now, apparently you can buy supplements containing 285 milligrams of dehydrated apple cider vinegar in some health food stores, maybe drugstores as well. I didn't know that. Once again, it would be best to take these supplements or any form of vinegar with a meal in order to slow the carbohydrate absorption into the bloodstream and improve insulin sensitivity. That's when you want to put it into your body with a meal. So I've included the scientific references and related summary reports in the text below. So thanks for watching, and I'll see you next time.